They've made an enormous difference to us in the work we do in family hubs. We run sessions for families right from pregnancy through to 19. And without the maternity champions, there might be communities and people we would never reach.
A crucial part of my work involves collaborating with community champions, particularly those focused on maternal and family health.
It has been an incredible reward to assist young mothers struggling in their breastfeeding.
I have supported more than 50 women in the community.
The community champions are connectors, and we bridge a gap between health services and really getting into grassroots level.
It is wonderful to see them working at that grassroots level where they actually connect with all these families.
The community champions are the answer to delivering against the requirements of the 10-year plan, the recommendations of the DASIO review, and also it's the solution to addressing the health inequalities.
We assist senior citizens through a breakfast club, where we serve healthy meals along with tea and coffee. We also run activities like chair, yoga, Zumba, bingo, creative art, workshops and training sessions.
It's really impact on their mental health, and a part of that is impact on their physical health as well by doing the chair yogas and Zumba classes.
I support the elderly people in the community one-to-one by walking them to their appointments, doing their shopping, and having a nice chat when they are feeling lonely.
The value champions bring is community intelligence. We speak to residents on daily basis. We reach those who can be quite difficult to reach for medical professionals.
I'm here to learn. I'm here to listen to mostly people from our local community and people from communities around our borough and Westminster. And I've been just engaged in a conversation about vaccination and trying to increase rates of vaccination.
The community champions are an essential integrator role as part of the integrated neighbourhood teams. They will bring local knowledge, insights at a hyper-local level back into sort of like health and social care to really direct and look at how we need to listen to our residents' voices and get healthcare right.
So one of the vital roles that they provide is the support for asylum guests in hotel accommodation.
So I'm coming from a community where mental health, it's something that is not spoken about, and it's a negative stigma within the community, especially in the Caribbean community, where men do not have that avenue or that medium where they can speak about their emotions or their feelings or their challenges. So I'm just here to learn more about how I as an individual can bring this back to the Mozart Group to help the community and bring men together.
The challenge which I foresee, which expectant fathers are not much more involved, which is one of the areas I'm actually passionate about.
The Climate Champions are local residents who want to make a difference for their communities and for the environment. We began designing the project in March 2024, and we launched our first group of champions in August, so we're still at the very beginning of the project, and yet we've achieved so much already.
Community champions, the maternity champions, are our frontline public health services. So they connect us into communities and help us reach communities and groups who may not otherwise come forward for services.
The stories that I've heard about the impact that the community champions have made across Westminster has been phenomenal.
I can see the comparisons with the other places where I've worked in other councils, so I think it is very well embedded, very well established, and the work that they're doing and the outcomes that are being achieved. So really very pleased.
Society would not be able to function without people like yourselves volunteering your time.
Keep us accountable to ensure that we provide the best possible services we can to our communities with our community champions' help and advice.
The work that we are going to be doing over the coming years is to maximise how we use our connectors and champions to start to create those links for our communities.
We live in a very complex health and care world, and I think that's wonderful because it allows us to have a rich use of all of our resources. But our champions help us find those very soft connections between our voluntary and community sector, our statutory health and social care providers, and our wider provision of health and care.
Lena 150 hours, Mahmood 100 hours,
the amount of hours that they've put in, their volunteering, and the way that they're helping others in their local community is fantastic.
Thank you sincerely for the work you do, the time that you give up, and the lives that you make better through your volunteering. Thank you very much.